So let's talk about the 4 types of sound therapy sounds that you can use. Again, we can go really deep with this, but I'm going to try to keep it light. Talk with your audiologist if you want to know more about these. Masking is the easiest one. So masking is just using some other sound to cover up your tinnitus. Again, a great example is coming home and turning on the radio a little louder so you can't hear your tinnitus at all. Great way if your tinnitus is flared up and bugging you. Just turn on the radio, turn it up, tinnitus goes away. Only problem with the masking is the minute you turn your radio off, that tinnitus is back. So again, great short-term relief, but in the long run, doesn't offer you a lot of relief. But for a short flare-up, masking works great. Distraction is similar to masking in that you're going to turn on another sound to kind of distract away from the tinnitus. You don't necessarily have to turn it up as loud as the tinnitus. In fact, you can still hear it, but it just distracts and gives you something else to listen to. This is where a lot of your tinnitus apps fall into, maybe nature sounds or something like that. But distraction is another source of giving you something else to pay attention to. This could even be where your hearing aids with different masking sounds or tinnitus sounds fall into play. Habituation is something I'm a huge fan with, and I use a lot of habituation with the hearing aids that I fit for tinnitus patients, whether they have hearing loss or not. But habituation is what you can ultimately use for tinnitus retraining therapy or sound therapy to teach your brain to stop paying attention to the tinnitus. So ultimately, habituation can be used long-term when you wear ear-level sound generators or hearing aids for 6 months to a year and you play a steady state noise, so usually a white noise or a hissing noise, something like a shh, that's actually a little softer than the tinnitus, and it just gives your brain a sound that kind of reinforces that it's hearing something more normal right under the tinnitus. And what happens is the brain gets used to that sound and it kind of just gives it that little, kind of like a blanket almost. It's something that's not as scary as the tinnitus and it gets used to hearing that sound. So yes, there's another sound, there's the tinnitus, but it gets used to hearing this other sound instead of the tinnitus. And then gradually over time you can start turning that sound down and the tinnitus isn't as scary. And so habituation works over 6 months to a year, maybe even 2 years, to reteach your brain that that tinnitus isn't as big as scary. So over time you can actually get to the point to reteach your brain that, you know, the tinnitus isn't that big of a deal. So that's what I work with most of my patients with their hearing devices or an ear level sound generator if they have normal hearing. So habituation is amazing. That's number one what I like to do with my patients because ultimately it offers that long-term return of not having to have that limbic system fired up with the tinnitus. Neuromodulation is another one that you might have your audiologist talk about, and that's just using certain fractal tones or certain sounds that are specifically picked out to give your brain something interesting and different to listen to. So I think about like Widex Zen hearing aids, or perhaps there's some specific other industry devices that have been targeted for tinnitus that you might have an audiologist mention that have been specifically researched for tinnitus retraining and again calming down that limbic system. But those are 4 basic types of sound therapy that your audiologist might mention. So that's the heavy stuff behind sound therapy that you might have heard. But again, this can be as easy as coming home, turning on a radio, and listening to your favorite music. So we'll talk more about that later.